Good morning, good afternoon, good evening, everyone. Welcome to the next episode of the Public Health John podcast. We're excited to jump into our next episode, but before we do, just a little bit of background. So the Public Health John, we are dedicated to really just reaching the social determinants of public health. When we think about where we work, where we live, where we play, whether that's transportation, whether that's food access, we cover it all on this podcast with a full open discussion. And we are so excited to get into our conversation today. I am your podcast host. I am Christine Ivory. I have a master's in public health and a lot of work in the field, in the industry, but particularly around maternal child health. So you'll see a lot of our conversation lean towards that way. And we know that all of those different pathways for moms, for birthing people, for families, all wraps and centers around the health. So without further ado, we're going to get into our conversation today. One piece of conversation, a really big part of conversation that's near and dear to my heart is preterm birth. And this month in November is Prematurity Awareness Month, where we know that throughout our nation, beyond the nation, even going from an international state, that premature birth is at a state of crisis. And so I know in New Jersey specifically, and we'll get into a lot of different numbers and rates and things of that nature, but I know that about 1 in 10 babies are born preterm. And why is that important? We know that when babies are born early, that there can be some issues with essential organs, the lungs, the liver, the brain, and a lot more. And so we just want to think about that, how it affects a child, how it affects a baby, how it affects birthing folks and family. And so we'll be digging into that part of the conversation today. And then also on the second part of that, thinking about the NICU. And so we have a specialist here today who is going to go over all of that. Yeah, she's already dancing. I like that energy. You'll see me dancing too. Okay, that is my maiden name, Dancy, so I am dancing. Let's get into introducing our special guest. So today we have NICU nurse. We have the founder. Can I say that loud? The founder of I Know Newborns. Yes. So we have Chelsea Sams here today. Once again, NICU nurse, founder of I Know Newborns, and just a few points from her bio, but we're going to dig deep into how she got into her journey. But Chelsea, she was born and raised in Long Island, hailing from Long Island, New York. She attended the University of Maryland, College Park, and obtained her bachelor's in science degree in public health, and that was in 2014. So after her undergraduate studies, Chelsea found her path in nursing and embarked on an intense 17-month accelerated BSN program at Johns Hopkins University School of Nursing. So I'm fast forwarding a little bit, Chelsea, but I know there's a lot in between. But Chelsea's work in the NICU, it fueled her passion for caring for newborns, for educating parents, for helping to navigate with those really important life pieces, advocating for the new bundles of joy that are coming about, and really just led her to create this wonderful organization that we know as I Know Newborns, and that was in 2023. So Chelsea, she currently resides in New Jersey, but she on the West Coast right now. She on West Coast time, okay?
I'm all over the place.
We love that, and it's great because she's given us some really great aspects and insights from wherever she is. And she's pursuing her master's degree in nursing education right now as well. So we want to welcome Chelsea to the Public Health Gems podcast. Hi, Chelsea.
Hi, I'm so happy to be here. Thank you for having me.
Yes, I was so excited when I said, hey, November, it's always been a time that's been blocked off for me, and just like really centering attention around newborns. And this is so important. And so can you talk about, we want to talk about a lot today, actually. So I'm not even going to just say one thing. There's many things that we're going to talk about. But first, thank you for joining our Public Health Gems podcast. And for our first question for you, we want to say, can you tell us about your background that puts together that public health emphasis and nursing? And as a second question, can you tell us how the experience really transfers to what you do today as founders of I Know Newborns?
Yes, absolutely. So as you mentioned before, I did my undergraduate studies at the University of Maryland, College Park, go Terps. I decided to go there because I really, really loved the school, but I was unsure if I wanted to be a nurse straight out of high school. Yeah, it was always a thought in the back of my mind. But I wanted to choose a school that I absolutely loved, and then like I wanted to worry about nursing like at some other time. So that's what I did. I chose Maryland because I loved Maryland. But I always had like a sciencey background, a health background, or liking to that topic in high school. So I said, you know what, I'm gonna go major in public health, take the prerequisites for nursing school, and if nursing is for me, it's for me, and I'm gonna go do what I got to do to get into nursing school after undergrad. So that is what I did. And I absolutely loved public health. I loved the program at Maryland. Um, and I graduated there and took all the prerequisites for nursing school, went on to nursing school, did an accelerated BSN program. So I have 2 bachelor's degrees, one in nursing and one in public health. Then ventured on into the nursing world, became a NICU nurse, then became a travel nurse. And throughout my journey as actually, I started as a mother baby nurse, actually, throw that in there. I did do mother baby for about a year and a half before going into the NICU. So most people know mother baby as maternity, like a maternity nurse or postpartum. And so throughout my time of being a NICU nurse, I have become the person that my friends and family call with all of their questions about babies and all their worries and what do I do with this, and even emergencies I've been called, like 911, and I'm on the phone with, my friend while she's waiting for 911, the ambulance to show up, and I'm, like coaching her through like what to do and doing an over the phone assessment. So I saw a need, right? I identified a need for that type of support person within my community, and my community obviously is the Black and brown community. And then, there was a lot of buzz around the maternal mortality rates in the United States, as it should be. We should definitely be ringing and sounding the alarm on the Black maternal mortality and morbidity rates in the United States. It's disgusting, right? It's like atrocious. It should never be what it is, but it is. But I didn't hear a lot of people talking about the Black infant mortality rates and disparities and racial disparities. And that's kind of how I Know Newborns came about. So I fused together my public health background with my nursing background and created a business that offers support for Black and brown parents. And that's how this all came about.
I love that. And we love that. We're so glad that you can be a part of a lot of our birthing stories with our bundles of joy, as you mentioned, and in your bio, and just how wonderful your work is, and expands into, just all of the great things, and advances our healthcare as a whole. And so leading into that next question, we know that it is Prematurity Awareness Month. And so when we think about this, and this is a bit of a long, as some people have told me, a loaded question,
Yeah.
which I'm known for, but during this month, as we acknowledge the preterm birth babies, and by the way, those who are listening in the podcast, a preterm birth baby, that is a baby that is born born at 37 weeks. As I know it from CDC standards. If I'm still incorrect, okay,
before 37 weeks.
Okay.
Yeah.
Great. I know I've been away from preterm birth for a little bit, but we know that babies that are born early have a greater risk of infant mortality, and that's a baby that loses his, her, their life before their first birthday. And so recently, the CDC has published new data that says that infant mortality has increased by 3%, and that's huge.
I saw that.
Yeah, and this is between 2021 to 2023 where we're at, and this is provisional data, but usually provisional data really just spells out what the now is and what they say. And so thinking about that rise of infant mortality, and this is the greatest rise that we've seen in 20 years, can you share more on tips for parents that are just thinking about going into having a safe pregnancy, those who may be pregnant or expecting right now, and those who are, early stages have their little newborn baby, like what should they know about safety after giving birth and perhaps even like while expecting? What are some of those like
Yeah.
keys to note?
So I think two things come to mind, and I want to say the first one before I forget it. I personally would tell Black and brown moms and dads to seek out Black and brown providers and doctors. So I'm talking not just your OB, but also your pediatrician. And don't wait until the baby is born to find your pediatrician, because if you know anything about getting the baby, like if you have kids, you know that there's wait lists upon wait lists, and it's hard to get newborns into, especially if it's a popular doctor. That's number one. There has been research that has been put out that shows that Black and brown babies that are cared for by Black and brown doctors, you see there's a difference in outcomes. There's better outcomes. So there's that. And so I would definitely tell parents to make sure you're doing your due diligence with your selection of your physicians. The second piece of advice, me personally, in my opinion, you could never like seek out too much education. So just educate. So it could be from the most basic level to the most complex level. And when I say basic level, I mean, if you know you're pregnant, go take a newborn care class, a basic newborn care 101. One of the biggest things that I stress to moms, my friends and family that get pregnant, is to take a breastfeeding class before the baby is born. And a lot of people don't listen. It's fine. I know we stressed and people are working and you're pregnant and there's a whole bunch of things you're getting ready for the baby. But taking a breastfeeding class is one of the biggest things that I can tell parents to do ahead of time, especially if breastfeeding is a goal, because people underestimate how hard breastfeeding it is, how much of a commitment it is. You think about it, you've never done it before, the baby's never done it before, so now y'all both never done it before. And people think that the baby's just going to come out and just, pop out and know what to do. And that's very seldom, rarely the case. So that's like on a basic education. On the more complex, education route, I would tell parents, especially if they know prenatally that their baby is going to be a NICU admission, or their baby, has is congenitally diagnosed with some type of something, and they're going to go to the NICU, to seek out NICU support ahead of time, seek out the neonatologists that may be, attending the delivery and talking to them, maybe take a tour of whatever NICU you're planning to deliver at, and just kind of getting acquainted with the NICU culture, because the biggest thing about NICU admissions is kind of like a culture shock for parents, and it's an education, what's the word I'm looking for? There's a huge learning curve. And so you think you know a lot about health and all that stuff, but it's different in the NICU, and babies are different, like all the way down to our like vital signs and lab values are just completely different than adults. So I think those are the two main things.
Those are two really great pointers, and we appreciate you for sharing them. And I say dropping gems. I'm going to continue to throw that in during the episode, but thank you for dropping those gems for us. Really important. I like the piece that you drew about education and how we can educate ourselves. And then if we know any other parents in our circle, which we will, because that's just inevitable, whether we're a neighbor, whether we're, mom, dad, grandma, it just happens because we're the tribe. So educating ourselves and then just sharing that education is so important. So I love all the points, but that was one that I was like, yes, we need that.
Yeah.
Another question for you. So on Public Health Gems, we always talk about what we just actually mentioned, the importance of tribe. So our partners, family members, friends, community, everybody. And so what are your thoughts on those key takeaways that the family should know about supporting birthing people and families in the NICU? Because I've heard really great insight on this, and I'm really looking forward to hearing your gems on this one as well.
I think friends and family that know people that are in the NICU should know that it is a very high stress, high anxiety time for parents.
Absolutely.
And especially for the moms, they just gave birth, so it's an extremely hormonal time for them. So on top of it being extremely just emotional and you're saddened that your baby is in the NICU, your hormones are racing because you just gave birth, and that's what your body naturally does after you give birth. So it's like 10 times, more intense. And so what friends and family should know is just to be as supportive as possible, whether that is helping out at home when mom and dad are in the NICU visiting baby, sending some money for meals. I know like the popular thing now is like the meal trains. That's always helpful, especially if there's an extended, like a long-term NICU stay. Because things get pricey, like gas, paying for parking. Sometimes it's not always free at hospitals. Sometimes you're traveling really far to your NICU because the level of care that your baby needs is, further away than where you live. So there's, I've taken care of babies that have parents that like, we live 2 hours away and we come here every day. Wow. And we drive 2 hours every day. So just being supportive from the outskirts as much as possible. It's tough because they just started rolling back out visitation in the NICUs to open to grandparents and aunties and uncles and even siblings. But they shut all that down during COVID. So you lost that little bit of support that you could have had during COVID when it was shut down. It could only be mom and dad. So now grandma and grandpa are able to come visit and learn how to take care of baby before, the baby is discharged, your auntie and uncle. And even the older siblings can meet the baby before coming home. So I think the biggest thing for families and friends is just to understand the emotional toll that the parents are going through, and be supportive in whatever way that they can, whether it's emotionally, financially, or just like, acts of service, doing things to ease their way.
Look, Chelsea, you are saying a word from all sides. Parents need all support, and so that is so important. Thank you for sharing on that. So we talked a little bit about this earlier. So when parents are in the NICU, whole different landscape, whole different area to get familiar with, and especially like you mentioned, if it's a longer stay, just a lot to navigate, if you will. So thinking about that patient advocacy portion,
Yeah.
and we know that's so important across all health sectors. But for patient advocacy in the NICU, we know it's important for families. Can you share more on how your work in the NICU as a NICU nurse and as a founder of I Know Newborns, how you promote amplifying patient voice? And I looked at your website, took a little bit of peek, probably a little bit more than a little bit, right? But can you share more about the great tools that you have to support, uplifting patient voice? Because it's important.
Absolutely. So I worked really, really hard on 3 ebooks, but I'm going to talk about 2 of them. I'm going to highlight 2 of them because they are directly related to the question that you're asking. The first one that I developed is a NICU parent glossary, and that is 300 terms, 300 words that I literally brain dumped on a piece of paper and defined in kind of like layman's terms, essentially, for parents to understand like the medical lingo and the medical jargon that's being thrown around in the NICU. And so my thought process behind that was, if I could create a tool for parents to just kind of like click up on their phone whenever they hear a word during rounds that the doctor says, and they can just quickly look up what it means, they can keep up with what's being said and not be left in the dark, because so often the medical jargon that we throw around is a barrier to communicating with the parents. And there are times where I'll say something to a parent and I was told that the parent was educated about XYZ, and I'll start talking about it with the parent because that's what I was told, and they're like, nobody explained it to me like that. I didn't know that's what that was, or you know what I mean?
Yeah.
So I think having a tool like that could be really, really useful. And so that is available for purchase on my website. It's called the NICU Parent Glossary. I worked really hard on it. And then the other one that I created is a NICU parent advocacy script. So there's certain words that you should use as a parent to kind of get the attention of doctors and nurses. And there are words that we are taught in nursing school and when doctors go to medical school, it's called the cuss words. And it's an acronym for something. And I don't want to give too much away, but I mean, people could look it up, so it's fine. But you use certain words that basically make nurses and doctors stop in their tracks. Mm-hmm. So when a parent says, "I'm concerned about my baby," that is supposed to trigger a hold up. Okay, we have a parent that's concerned about their child. Let's stop and listen. What are you concerned about? What are you uncertain about? Let's talk about it, right? And so I created basically a script that incorporates the cuss words that for parents to use, and then also tips and tricks on how to, organize family meetings in the NICU, how to talk to the doctors and nurses in the NICU, and utilizing the parent advocacy script with the glossary together. I just feel like Black and brown parents, well, any parent actually, but that's my target audience is Black and brown parents, would be better equipped to adequately advocate for their babies, because babies can't speak, right? And the parents can speak, but they can't speak the medical jargon that's gonna hit home the way they need it to hit home when they they're talking about their baby and they want changes for their baby. So those are the two main things. And the parent advocacy script is also available for purchase. And I also worked really hard on that too.
Listen, these are the tools that we need in our toolbox. Mm-hmm. Just thinking about having this, because we could have these conversations with our provider, but having that confidence and that type of behind you is so important. And I always say a team, a tribe, and everything. But if it's you and your partner, however the situation may be, just having those words sound so empowering. We already have that power in us, but it just activates that. So we thank you for creating those wonderful books for us. And we're gonna look at the website. Shoot.
Please do. I know newborns.com, y'all.
Yeah. And we're going to have that in our show notes as well. So make sure that you're tuning in for the ebooks, but then Chelsea adds so much great pertinent information to the website. So do check it out.
Yes, there's lots of free resources on the website. I worked really hard on the resources section, and I'm actually really proud of the resources section. So definitely check that out.
Yes. And that segues to, oh my gosh, our last question, which I cannot believe time flies when you're having a great conversation with a health professional. But can you share more on resources that address newborn, NICU, family support? We know that there's all different varying perspectives, because families are going to need support. Baby's going to need what baby needs, all these different types of pockets within this, NICU realm. So thinking about any resources that you have, and then also, are there any recommendations that you will provide to our future public health professionals, those who want to advance NICU and newborn support for the future?
Okay. So off the top of my head, so I'm also a certified car seat technician.
Yeah.
And one of the biggest things, I'll be very honest. When I see friends and family posting photos of their babies in the car seat, I'm telling you, 8 times out of 10, the baby is not in the car seat the right way.
Oh, wow.
What I see. And I cringe a lot from how I see either the car seat is installed improperly, or the baby's secured improperly, or there's extra toys and gadgets added to the car seat that shouldn't be there, that weren't tested with the car seat. So I do have a resource, kind of like a drop down for just car seat safety, because one of the leading causes of infant mortality is car accidents. So, and that could be, a lot of the times is because of the misuse of the securing of the car seat, not just the impact, so it's very, very important that people educate themselves on how to properly install their car seats, make sure the car seat is the right size for their baby, and everything all in between. So that is on my website. You can get your car seat checked for free. At sometimes they're like police stations or fire departments. But you can look it up online, and it's I believe I tagged it in on my website. And you can put in your zip code, and it'll tell you the closest like car seat safety check point. And all you have to do is bring your car seat, and they will check it if you've already installed it, or they will install it for you. So that's one thing that comes like to the top of my mind. The American Academy of Pediatrics is also a great resource for just general newborn care. I think their website is healthychildren.org. But they have like a lot of research and stuff like that. And then just general newborn tips. There's tons of nonprofit organizations that are dedicated to NICU support. So March of Dimes is like one of the biggest ones. I recently connected with Hand to Hold. That's another one. It's a little bit smaller than March of Dimes, but they're also fantastic. And there's a whole bunch of other ones. I have some of them on my website as well. For people of color, I've got a whole section for people of color: Chocolate Milk Cafe, Earth App, the National Black Doula Association. And then there's also like just breastfeeding support that I have on my website as well. The Nest collaboration, WIC, Women and Children, the La Leche League, Zip Milk, a whole bunch of stuff. But like I said, like the more preparation you can do before the baby gets there, the better. So just educate.
Absolutely. Thank you for sharing that. So pretty much, if you heard that, that means just go to Chelsea's website and look at the resource tab. You're going to find it all there, but we're going to load it in our show notes and make sure that you have the directions to that resource mapping that she has laid out for us so eloquently. Chelsea, I can't leave this episode without saying it, because you made me think about the safety with car seats and how that it sounds like it's such a big epidemic, which I didn't even know about the whole death and breath of it. But then I also think about safe sleep. So when you get home, babies at home now, can you give us like a little bit of just some high levels behind the safe sleep? Because I know when we talk about infant mortality, that's a topic of our conversations too. Yeah.
Yes. So SIDS and safe sleep go hand in hand. Sudden infant death syndrome, SIDS is the acronym. So super old school, you know, grandma and grandpa, when you have a baby, they're gonna be like, put that baby on the belly. He gonna sleep better on his belly. Because he's sleeping on his back. You don't like sleeping on his back. Put the baby on the belly. He gonna sleep through the night, right? Grandma and grandpa gonna come out with all the old school put cereal in the milk. He'll sleep through the night. Put cereal. That's also not recommended anymore, by the way. Please don't put cereal in your children's milk. Like, talk to your pediatrician. It's no longer recommended. It's not a thing anymore. Conversation for another day. But the safest position for your baby is to sleep on their back at all times with no extra toys, gizmos and gadgets or blankets in the crib. The baby should always be sleeping in their own sleep space, so in their own bassinet. Co-sleeping is not encouraged, so a lot of times parents will sleep in the bed with the baby. That is dangerous because you could roll over on the baby. A blanket could go over on the baby's face, and the baby doesn't know, oh, I can't breathe. Let me move this blanket out the way. And then, you know, mom and dad are passed out asleep, and, you know, bad things can happen. The other thing that I feel like is not mentioned enough, and I usually try to make sure I remember when I'm doing discharge education, is if you have pets. Cats are notorious for climbing into babies' cribs and kind of like sleeping on top of babies. So you have to be mindful of cats. And you should never leave your, you know, baby in a room alone with a dog or any pet, honestly. So there's those things as well for safe sleep. Oh my gosh, what else about safe sleep? Those are the main things. You know, you can buy, they've come up with some really great gadgets and gizmos for sleeping. So they have the sleep sacks now, so you can safely swaddle your baby. And you don't have to worry about like blankets, you know, going over their face or anything like that. If you're going to swaddle your baby, it should be either a sleep sack swaddle or a swaddle that they can't get out of. Like, and most parents don't swaddle like the greatest initially. Like, it takes practice to swaddle really, really well, and for the baby not to break out of the swaddle. So the sleep sacks are great. But yeah, safe sleep is definitely a big one. SIDS can be preventable. I believe most of the time it is preventable. There are often, there's times where it's not. But you just want to make sure that you're set up like sleep wise, like baby should have their own bed, nothing, no toys in the bath, no stuffed animals, none of that.
Yeah. Thank you for for going off script with me real quick and just sharing that. It's so important. And I want to say this too, because in the prematurity space, we always like to say this in our materials and in our conversations, because some folks, I mean, a lot of folks, when we have a preterm birth baby or early birth baby, we're like, it's my fault. I could have did better. And sometimes there's things that we can do, as humans, to just promote our own health or promote our own pregnancy. But I do want to say with infant mortality, preterm birth, it's not always pointing to just one thing. Sometimes things unfortunately do happen and there's not like necessarily a reason behind it. So I do want to say that disclaimer, that you can do all things right and still have a preterm birth or infant mortality, just for those who are listening in. So we do not want any blame or shame to come from this conversation. But
absolutely. And I should have made a point, to that point, I should have mentioned earlier that you can I'm like preaching education and preparation, but there is research out there that accounts for like socioeconomic status and education level among Black women. And there are still racial disparities among the Black infant mortality rates. There are some of the highest, I was just reading last night while I was at work, the highest the age group, or I guess education group, is like the doctoral level of Black women that have babies. They have the highest infant mortality rates among Black women. And you would think it would be the opposite, right? It's not. So sometimes even when you correct for education, income, and all of the things, and you do everything right, the system is unfortunately still working against us. Yep. And for whatever reason, we're still being oppressed, but that's why we're here working. That's why we're doing this podcast.
Yes.
To work through it.
Thank you for saying that, because we got to say it, because it's important to line out and say. Yeah. So with all that, we thank you for being here, Chelsea. We know that we have a busy, full schedule. Founder of this beautiful organization, I Know Newborns, as well as a NICU nurse. And we just thank you for stopping by and taking some time to drop gems on us. So
thank you for having me.
No, thank you for being here. And so if the people want to find you, if they're like, hey, how can I track her down? I want to hear more about this great organization that she started. Where can the people reach you and where can they find you?
Yes. So I am on Instagram at I Know Newborns. I'm on LinkedIn. I Know Newborns. That's my my business page. And then we are also on Pinterest. We've been giving Pinterest a try. Yeah, I Know Newborns on Pinterest. So it's LinkedIn, Instagram, and Pinterest. Those are the three right now, the top three. We will be venturing into, I know, like, I'm trying not to do TikTok, but I know I'm eventually gonna have to do TikTok. That's, that's where it's at right now. And maybe we might venture into a little bit of Facebook, but right now it's Instagram, Pinterest, and LinkedIn. You can and then our website, iknownewborns.com.
Listen, we're going to be looking for you on all ends of the spectrum, on the website, on social, just anywhere where you are talking and sharing this great education and information. We're looking for you, Chelsea. So thank you again for being here. We're just going to be putting Chelsea's information in the show notes and making sure that we have full access to everything that she is doing. Be on the lookout for the great work that she has behind her. Please join us for another episode of the Public Health Gems podcast. Right now I am in, I would say sunny Atlanta, but I would say kind of a foggy-ish Atlanta today, probably sunny tomorrow. for the APHA conference or annual meeting. So shout out to all the public health professionals in the city. I know we'll air after, but had to say it. And Chelsea, thank you again for being here. We really appreciate the gems that you dropped, the insight, and just the valuable points that you bring for moms, for babies, for parents, for the whole tribe. So we appreciate you.
Thank you so much for having me. Thank you for thinking of me. I'm so excited for this episode. I'm gonna listen to my own episode. I'm gonna be like, ooh, I said that. Wow, that sounded good.
Chelsea, you at the top of our list. Okay, so we're gonna be looking out for her. But until next time, we'll see you then. Thank you, everybody.